The automatic doors of St. Mary's emergency room exploded open with a thunderous crash as Marcus Tank Rodriguez barreled through them like a human battering ram. At 7 feet tall and weighing close to 300 pounds of solid muscle, he had to duck slightly to avoid clipping his head on the doorframe. His steel-toed boots echoed against the polished linoleum floor with each heavy step. Announcing his arrival to every person in the packed waiting room, blood trickled down from a jagged gash above his left eyebrow, painting crimson streaks across his weathered face before dripping onto his torn construction vest. His hard hat dangled from one massive hand while the other pressed an oil-stained rag against the wound. Despite the injury, Tank moved with the casual confidence of a man who'd walked away from worse situations without breaking stride. "Just a scratch," he announced to no one in particular, his voice booming across the waiting area like a foghorn. Several patients looked up from their phones and magazines, their eyes widening as they took in his imposing frame. A mother instinctively pulled her young daughter closer, while an elderly man in a wheelchair seemed to shrink into his seat. Tank surveyed the chaos around him with the detached amusement of someone watching a children's playground. Crying babies, anxious families huddled together, the constant beeping of medical equipment, it all seemed so soft, so sterile. So completely unlike the brutal reality of his construction site where real men handled real problems without all this fuss and paperwork. He'd survived 3 knee surgeries from his college basketball days, walked away from a 2-story fall that should have killed him, and once stitched up his own arm with fishing line after a bar fight went sideways. This pristine hospital environment, with its sanitized surfaces and hushed voices, felt like amateur hour compared to the daily gauntlet of his blue-collar existence. The triage nurse, a middle-aged woman with graying hair pulled back in a tight bun, looked up from her computer screen as Tank approached her station. Her eyes traveled upward, following the seemingly endless expanse of his frame until she finally met his gaze somewhere near the ceiling. "What seems to be the problem today?" she asked in the practiced monotone of someone who'd seen everything twice. Tank gestured dismissively at his bleeding forehead. "Fell off some scaffolding about an hour ago. Happens all the time in my line of work. Just need someone to slap a bandage on it so I can get back to the job site." The nurse's fingers flew across her keyboard as she entered his information. "Any loss of consciousness? Nausea? Dizziness?" Nope, and nope." Tank lied smoothly, ignoring the persistent throbbing in his skull and the way the fluorescent lights seemed just a little too bright. "Like I said, this is nothing. I've had paper cuts worse than this." As he spoke, Tank's attention wandered to the bustling activity behind the triage desk. Nurses in colorful scrubs hurried back and forth, their movements efficient and purposeful. Doctors in white coats consulted charts and barked orders. The whole operation reminded him of a construction site, except instead of hard hats and steel beams, everyone wore stethoscopes and carried clipboards. That's when he spotted her dot near the medication card. A petite Asian woman fumbled with a stack of patient charts, her hands visibly shaking as she tried to organize them. Her scrubs looked freshly pressed, still bearing the crisp creases from the package. A brand new ID badge hung from a retractable cord, the plastic still gleaming under the harsh hospital lighting. She couldn't have been more than 5 feet tall and probably weighed less than Tank's left leg. Tank's lips curved into a predatory grin. Fresh meat. The rookie nurse, he could spot them from a mile away, dropped one of the charts, sending papers scattering across the floor. She scrambled to collect them, her face flushing red with embarrassment as a more experienced nurse stepped around her with barely concealed irritation. "First week?" Tank called out, his voice carrying easily across the busy corridor. The young nurse looked up, startled, her dark eyes wide behind wire-rimmed glasses. She clutched the rescued papers to her chest like a shield, clearly overwhelmed by the controlled chaos surrounding her. Yes, actually, she stammered, her voice barely audible above the ambient noise of the air. How did you know? Tank's grin widened, revealing teeth that had seen their share of fights. Lucky guess, sweetheart. You've got that deer in headlights look down to an art form. The triage nurse cleared her throat loudly, drawing Tank's attention back to the matter at hand. Mr. Rodriguez, you can have a seat in the waiting area. Someone will call you when we're ready. Tank glanced around the crowded waiting room, taking in the sea of uncomfortable plastic chairs that looked like they'd been designed for people half his size. Every seat was occupied, and even if one had been available, he doubted it would support his weight without collapsing. How long we talking here? He asked, checking his watch. It was barely past noon on a Friday, and he had a concrete pour scheduled for 3 o'clock. Missing that deadline would cost his crew overtime pay and put them behind schedule for the entire week. Could be anywhere from 30 minutes to 3 hours, depending on the severity of cases ahead of you, the nurse replied without looking up from her screen. Head injuries are typically fast-tracked, but we're pretty backed up today. 3 hours? Tank's jaw clenched. He'd been in and out of emergency rooms before, but never for anything this minor. A simple cut shouldn't require half his afternoon sitting in an uncomfortable chair surrounded by sick people and crying children. He was about to voice his objection when the rookie nurse approached, still clutching her charts like a lifeline. Up close, she looked even younger than he'd initially thought, probably fresh out of nursing school and thrown into the deep end of one of the city's busiest emergency departments. "Excuse me," she said softly, her voice carrying a slight accent he couldn't quite place. "I couldn't help but overhear. You mentioned falling from scaffolding?" Tank nodded, already bored with the conversation. "Yeah, about 12 feet up. Landed on my feet like a cat. Just caught my head on a beam on the way down. No big deal." The nurse's eyebrows furrowed slightly, and she made a note on one of her charts. "Any other symptoms besides the laceration? Headache? Changes in vision?" "Listen, kid," Tank said, his patience already wearing thin. "I appreciate the concern, but I've been doing construction for 15 years. I know the difference between a serious injury and a scratch that needs a Band-Aid. This is definitely the latter." The young nurse nodded quickly, clearly intimidated by his size and gruff demeanor. "Of course, I just wanted to make sure. What's your name anyway?" Tank interrupted, deliberately flexing his massive arms as he crossed them over his chest. The movement caused his biceps to strain against the fabric of his work shirt, emphasizing the sheer difference in their physical presence. "Sarah," she replied quietly. "Sarah Chun." "Wow, Sarah Chun," Tank said, drawing out her name with mock formality. "Why don't you focus on learning how to hold on to those charts before you start playing doctor with the grown-ups?" Sarah's face flushed crimson, but she didn't back down. Instead, she straightened her shoulders and met his gaze directly. "I'll make sure to note your concerns in your file, Mr. Rodriguez." Tank watched her walk away, noting the slight tremor in her hands and the way she seemed to second-guess every step. This was going to be easier than he thought. 2.5 hours crawled by like molasses in winter. Tank had commandeered 3 plastic chairs, arranging them in a makeshift throne that barely accommodated his massive frame. His legs stretched far into the walkway, forcing other patients and staff to navigate around him like he was a piece of immovable furniture. The initial trickle of blood from his forehead had dried into a crusty brown line, but the throbbing in his skull had evolved from a minor annoyance into something that felt like a jackhammer operating inside his brain. He'd watched Sarah Chun stumble through her duties with the detached amusement of a predator observing wounded prey. She dropped charts twice more, fumbled with an IV bag until a senior nurse had to step in, and nearly collided with a doctor while backing out of a patient room. Each mistake seemed to chip away at her already fragile confidence, and Tank found himself looking forward to their inevitable interaction. The waiting room had turned over completely since his arrival. The crying babies had been replaced by different crying babies. The anxious families had given way to new anxious families. But Tank remained, a constant fixture, growing more irritated by the minute. His concrete pour was already shot. His crew was probably wondering where the hell he'd disappeared to. And his foreman would have his ass if this simple hospital visit cost them the weekend overtime. Rodriguez Marcus. A voice finally called from the triage desk. Tank unfolded himself from his makeshift chair arrangement with a series of pops and cracks that sounded like breaking kindling. Several nearby patients looked up nervously as he rose to his full imposing height, his shadow falling across half the waiting area. "About damn time," he muttered, loud enough for everyone to hear. He followed the voice toward the treatment area, ducking under doorways and squeezing through corridors that seemed designed for normal-sized humans. The familiar antiseptic smell of hospitals filled his nostrils, that peculiar combination of bleach, latex, and barely contained human misery that always made his skin crawl. "Room 7, the voice directed. And Tank found himself face to face with his worst nightmare, Sarah Chun, standing outside a small examination room with a clipboard in her trembling hands and that same deer-in-headlights expression she'd worn 3 hours earlier. "You've got to be kidding me," Tank said, his voice dripping with disdain. "They're letting the rookie handle head injuries now?" Sarah's grip tightened on her clipboard, but she managed to maintain eye contact. "I'm perfectly qualified to perform an initial assessment, Mr. Rodriguez. Please have a seat on the examination table." Tank glanced at the narrow padded table and snorted. "That thing looks like it was built for a 10-year-old. You sure it won't collapse under a real man's weight?" "The tables are rated for up to 400 pounds, Sarah replied quietly, consulting her notes. "You should be fine." The casual way she'd estimated his weight and been uncomfortably accurate caught Tank off guard for a moment. But he quickly recovered, using his size advantage to loom over her as she prepared her equipment. "So tell me, sweetheart," he said, deliberately invading her personal space, "exactly how many head injuries have you treated in your illustrious career? And I'm talking about real injuries, not paper cuts and scraped knees." Sarah's hand shook slightly as she unwrapped a blood pressure cuff, but her voice remained steady. "I've had sufficient training in trauma assessment and training," Tank interrupted with a harsh laugh. "That's rich. You know what my training was? 15 years of getting the shit kicked out of me by life and walking away from it. Real-world experience, not some textbook fantasy." As Sarah attempted to wrap the blood pressure cuff around his massive bicep, Tank deliberately flexed his arm, causing the fabric to strain and making her job nearly impossible. She struggled with the positioning, her small hands barely able to manipulate the cuff around his circumference. "Having some trouble there, Doc?" Tank asked with mock concern. "Maybe you should call for backup. Get someone who actually knows what they're doing." Sarah's jaw tightened, but she persisted, finally managing to secure the cuff properly. As the machine inflated and began its reading, Tank noticed something that made his stomach drop. The numbers on the display were climbing higher than they should have been. Much higher. "That can't be right," he said, his bravado faltering slightly. "Run it again." Sarah frowned at the reading -180/110 and nodded. Sometimes the first reading can be elevated due to stress or anxiety. "Let me try again." The second reading was even worse, 185/115. "What the hell does that mean?" Tank demanded, though he had a sinking feeling he already knew. His father had died of a stroke at 55, and his grandfather had dropped dead of a heart attack at 60. High blood pressure ran in the Rodriguez family like a genetic time bomb. It means your blood pressure is significantly elevated, Sarah said, a professional demeanor beginning to override her nervousness. Combined with your head injury, this could indicate what? Tank's voice had lost its mocking edge, replaced by something that sounded dangerously close to fear. Sarah set down her equipment and looked at him directly, her earlier timidity evaporating. Mr. Rodriguez, I need you to be completely honest with me. Since your fall, have you experienced any nausea? Dizziness? Changes in your vision? Tank's mouth went dry. The truth was, he'd been fighting waves of nausea for the past hour. The fluorescent lights seemed to pulse and flicker in ways that made his eyes water. And when he'd stood up from the waiting room chairs, the entire world had tilted sideways for a terrifying moment before righting itself. But admitting weakness wasn't in his DNA. I told you already, I'm fine. Just patch me up so I can get out of here. Sarah stepped closer, and Tank was surprised to find that her proximity didn't feel intimidating anymore. It felt oddly comforting. Mr. Rodriguez, I understand that you're used to handling things on your own. But right now, I need you to trust me. Can you do that? Something in her tone made Tank pause. Gone was the nervous rookie who dropped charts and fumbled with equipment. In her place stood someone who radiated quiet confidence and genuine concern. It was like watching a completely different person emerge from inside the same small frame. Why should I trust you? He asked, but the question lacked his earlier venom. Sarah pulled a small penlight from her pocket and moved toward his face. Because despite what you think about my experience, I know what I'm looking at. And right now, what I'm seeing scares me. The penlight beam hit his eyes, and Tank instinctively tried to pull away. The light felt like molten metal boring into his brain, sending spikes of agony through his skull that made him gasp involuntarily. Photophobia, Sarah murmured, making notes on her chart. Mr. Rodriguez, I'm going to ask you to follow my finger with your eyes, okay? As her finger moved back and forth in front of his face, Tank realized with growing horror that he was seeing two of everything. Two Sarahs, two fingers, two examination rooms that seemed to overlap and separate like a broken television signal. I can't. He started, then stopped, his pride warring with his growing fear. You're seeing double. Aren't you? Sarah asked gently. Tank's massive shoulders sagged in defeat. Yeah, he whispered. For about an hour now. Sarah's expression grew grave as she continued her examination, her small hands probing his skull with surprising expertise. When she found the tender spot behind his left ear, Tank nearly came off the examination table. Jesus Christ! He roared, his hand instinctively moving to swat her away. But Sarah didn't flinch. Instead, she caught his wrist with both hands, a laughably futile gesture given their size difference, and looked him straight in the eye. Mr. Rodriguez, she said, a voice carrying an authority that seemed to come from somewhere deep inside her small frame. You need to stop fighting me and start listening. Your life might depend on it. Tank's hand froze mid-swing. Sarah's tiny fingers wrapped around his massive wrist like a child trying to stop a freight train. But something in her eyes, a steely determination that seemed completely at odds with her diminutive frame, made him pause. For the first time since entering the hospital, he felt a flicker of genuine uncertainty. Let go of me, he said, but the words came out as more of a question than a command. Sarah released his wrist, but didn't step back. Instead, she moved closer, her face now inches from his. Mr. Rodriguez, I need you to listen very carefully. You have classic signs of increased intracranial pressure. The photophobia, diplopia, elevated blood pressure, and point tenderness behind your mastoid process all indicate potential brain swelling. Tank blinked, trying to process the medical terminology through the fog that seemed to be settling over his thoughts. In English, Doc. Your brain is swelling inside your skull, Sarah said bluntly. And if we don't address it immediately, you could die. The words hit Tank like a physical blow. He'd faced down angry foremen, bar fights, and construction accidents that would have sent lesser men running. But the quiet certainty in this small woman's voice terrified him more than anything he'd ever encountered. "You're wrong," he said, but his voice lacked conviction. "It's just a cut. I've had worse." Sarah pulled out her penlight again, and this time Tank didn't resist as she examined his pupils. Her movements were precise and methodical, nothing like the fumbling rookie he'd mocked earlier. She checked his reflexes with a small hammer, tested his coordination with simple finger-to-nose exercises, and asked him to walk a straight line across the small examination room. Tank failed every test spectacularly. His pupils were unequal, the left one sluggish to respond to light. His reflexes were hyperactive on one side and diminished on the other. When he tried to touch his nose with his index finger, his hand wavered like he was drunk, and the straight-line walk? He veered so far to the left that he nearly crashed into the wall. "This is impossible," Tank muttered, staring at his own hands as if they belonged to someone else. "I was fine this morning. I drove myself here, for Christ's sake." Sarah was already moving, her earlier nervousness completely replaced by focused efficiency. She grabbed the phone on the wall and dialed an extension. "Dr. Martinez to room 7, stat. Possible traumatic brain injury with signs of increased ICP." Wait, Tank said, panic creeping into his voice. "You're overreacting. I just need some aspirin, and when exactly did you fall?" Sarah interrupted, her pen poised over her chart. "Around 9 this morning, maybe 9:30. "And what time is it now?" Tank glanced at his watch, squinting to bring the numbers into focus. "Almost 3:30. 6 hours, Sarah said grimly. "Mr. Rodriguez, brain injuries don't always present symptoms immediately. Sometimes the bleeding is slow, gradual. The pressure builds over hours until—" She didn't finish the sentence, but Tank could fill in the blanks. Dr. Martinez burst through the door, a compact, Hispanic man in his 50s with graying temples, and the confident bearing of someone who'd seen everything twice. He took one look at Tank's condition and Sarah's notes, then began his own rapid assessment. "Talk to me, Chun," he said, his hands already examining Tank's head wound. Sarah's transformation was complete now. Gone was any trace of the nervous rookie Tank had tormented in the waiting room. In her place stood a medical professional rattling off observations with clinical precision. 7-foot male, approximately 280 pounds, fell 12 feet from scaffolding at approximately 0930 hours. Initial presentation was as simple: laceration, but patient has developed progressive symptoms over 6 hours. Current findings include diplopia, photophobia, unequal pupils with left pupil sluggish to react, hyperreflexia on the right side, diminished coordination, and hypertension reading 185/115. Dr. Martinez nodded grimly. "Mechanism of injury?" "Patient reports landing on his feet but striking his head on a beam during the fall. Point tenderness behind the left mastoid process suggests possible temporal bone fracture." Tank watched this exchange with growing amazement. The woman who dropped charts and fumbled with equipment was now speaking medical terminology like a native language, her observations precise and her delivery confident. It was like watching Clark Kent transform into Superman. "How did you know to check behind my ear?" Tank asked, his voice barely above a whisper. Sarah glanced at him while Dr. Martinez continued his examination. "Battle sign, bruising behind the ear that indicates a basilar skull fracture. It doesn't always present immediately, but the tenderness can be an early indicator." "But you're just a nurse," Tank said, confusion evident in his voice. "How do you know all this?" For the first time since her transformation, Sarah's professional mask slipped slightly. "I know because I've seen this before. Many times." Dr. Martinez looked up from his examination. Chun, get him to CT immediately and call neurosurg. We might need them on standby. As Sarah moved to arrange the transport, Tank grabbed her arm with surprising gentleness. Wait, I need to know something. You said you've seen this before. Where? Sarah hesitated, glancing at Dr. Martinez, who nodded encouragingly. I was chief of neurosurgery at Damascus General Hospital for 8 years, she said quietly, before the war made it impossible to practice there. Tank's jaw dropped. You're a brain surgeon? Was, Sarah corrected. Here, I'm a nurse while I complete the process to transfer my medical license. It's complicated. The pieces suddenly clicked into place for Tank. The precise examination, techniques, the confident medical terminology, the way she'd immediately recognize symptoms that he'd been trying to hide. She wasn't a rookie at all. She was a seasoned surgeon forced to start over in a new country, working beneath her qualifications while navigating bureaucratic red tape. Jesus, Tank breathed. And I called you sweetheart. I told you to focus on holding charts. Sarah's expression softened slightly. You weren't the first patient to underestimate me, Mr. Rodriguez, and you won't be the last. But you saved my life, Tank said, the full weight of his situation finally sinking in. If you hadn't caught those symptoms. That's what we do, Sarah replied simply. Now, we need to get you to CT before your condition deteriorates further. As the orderlies arrived with a wheelchair, a heavy-duty model designed for larger patients, Tank looked at Sarah with newfound respect and more than a little shame. I'm sorry, he said, for everything I said, for how I treated you. Sarah helped guide him into the wheelchair, her small hands surprisingly strong and steady. Apology accepted. But right now, let's focus on making sure you live long enough to mean it. As they wheeled him toward the CT scanner, Tank caught a glimpse of Sarah's reflection in the polished hospital corridor windows. She walked beside his wheelchair with the confident stride of someone who belonged exactly where she was, regardless of what her ID badge said. Her earlier nervousness had been completely replaced by the quiet authority of a surgeon who'd spent years making life-and-death decisions. Tank realized he'd learned more about judging people in the past hour than in his previous 35 years of life. Size, appearance, job titles. None of it mattered when someone's life hung in the balance. What mattered was skill, knowledge, and the courage to act when it counted. And the tiny woman walking beside him had all three in abundance. The CT scanner hummed like a mechanical beast as Tank's massive frame disappeared into its cylindrical maw. Through the observation window, Sarah watched the images populate on the monitor screen, her trained eye immediately recognizing the telltale signs she'd hoped not to see. Dr. Martinez stood beside her, his expression growing grimmer with each slice of Tank's brain that appeared on the display. There, Sarah said quietly, pointing to a crescent-shaped shadow on the left side of Tank's skull. Subdural hematoma with approximately 8 millimeters of midline shift. Dr. Martinez nodded gravely. Good catch, Chen. Another few hours and we'd be looking at brain herniation. He turned to the radiology technician. Get neurosurgery down here now. And prep OR3. Tank emerged from the scanner looking smaller somehow, despite his imposing physical presence. The bravado that had carried him through the day had evaporated, replaced by the hollow-eyed expression of a man confronting his own mortality. Sarah approached him as the orderlies prepared to transfer him to a gurney. Well? Tank asked, though his voice suggested he already knew the answer wouldn't be good. Sarah pulled up a chair beside his wheelchair, bringing herself to eye level with the giant who towered over her just hours earlier. Mr. Rodriguez, the scan shows bleeding between your brain and skull. The blood is putting pressure on your brain tissue, which is causing your symptoms. Tank's massive hands clenched into fists. How bad? Bad enough that you need surgery. Tonight. Sarah's voice was gentle but unflinching. "The neurosurgeon will need to drill a small hole in your skull to drain the blood and relieve the pressure." The color drained from Tank's weathered face. "Surgery? But I can't afford." "My insurance doesn't." "Mr. Rodriguez," Sarah interrupted, placing her small hand on his enormous forearm. "This is a life-threatening emergency. The hospital will treat you regardless of your insurance status. We'll worry about the paperwork later." Tank stared at her hand on his arm, so tiny it barely covered a fraction of his massive forearm, yet somehow providing more comfort than he'd felt all day. "I could have died, couldn't I? If I'd gone home like I planned?" Sarah nodded solemnly. "The bleeding would have continued. Eventually, the pressure would have caused your brain to herniate, to shift inside your skull. That's almost always fatal. And you caught it," Tank said, his voice filled with wonder. "A rookie nurse on her first week caught something that could have killed me." "I'm not exactly a rookie," Sarah said with a slight smile, "though I understand the confusion." Tank was quiet for a moment, processing everything that had happened. When he spoke again, his voice was thick with emotion. "I was such an ass to you. Called you sweetheart. Told you to stick to holding charts. Made fun of your experience." He shook his head in disgust. "And the whole time, you were more qualified than anyone else in this place." Sarah's expression grew thoughtful. "You want to know something, Mr. Rodriguez? In Damascus, I was Dr. Chun. I had a corner office, a team of residents, respect from my colleagues. I performed complex brain surgeries and saved lives every day." She paused, looking down at her nurse's scrubs. "Here, I'm starting over. Learning new protocols, new systems, new ways of doing things I've done for years. Some days, I do feel like that nervous rookie you saw today." "But you're not," Tank insisted. "You're a surgeon. A damn good one, from what I can tell." "I'm a nurse right now," Sarah corrected gently. "And there's nothing wrong with being a nurse. Some of the most skilled medical professionals I've ever worked with were nurses. The title doesn't make the person. The knowledge and compassion do." Tank felt a lump forming in his throat. "I've spent my whole life thinking bigger was better. Stronger was smarter. That intimidation could solve any problem." He gestured weakly at his massive frame. "Look where that got me." The neurosurgeon arrived. Dr. Patricia Williams, a sharp-eyed woman in her 40s who moved with the confident efficiency of someone accustomed to high-stakes situations. She reviewed Tank's scans quickly, then approached his bedside. "Mr. Rodriguez, I'm Dr. Williams. I'll be performing your surgery tonight. The procedure is called a craniotomy. We'll make a small opening in your skull to remove the blood clot and stop any active bleeding." Tank's face went pale. "How small is small?" "About the size of a quarter," Dr. Williams replied matter-of-factly. "The surgery typically takes 2 to 3 hours, and recovery is usually straightforward for someone your age and physical condition." "Usually?" Tank's voice cracked slightly. Dr. Williams sat down beside him, her manner becoming more gentle. "Mr. Rodriguez, I won't lie to you. Any brain surgery carries risks. But without this procedure, your condition will continue to deteriorate. The choice isn't really whether to have surgery or not. It's whether to have it now, when your chances are excellent, or wait until it becomes an emergency with much worse odds." Tank looked around the room at the faces surrounding him. Dr. Martinez, Dr. Williams, the orderlies, and Sarah. All of them were focused on him, dedicated to saving his life, despite the fact that he'd been nothing but difficult and dismissive since arriving. "Sarah," he said suddenly, his voice urgent, "will you be here when I wake up?" Sarah glanced at Dr. Williams, who nodded. "My shift doesn't end until 7 tomorrow morning. I'll be here." Tank reached out with his massive hand, and Sarah took it without hesitation. Her small fingers disappeared completely within his grasp, but her grip was firm and steady. "I need to tell you something," Tank said, his voice barely above a whisper. "I was scared. From the moment I walked in here, I was terrified. The headache, the dizziness, the way everything felt wrong, but I couldn't admit it. Couldn't show weakness." Sarah squeezed his hand gently. "Fear doesn't make you weak, Mr. Rodriguez. It makes you human. And admitting when you need help. That takes more courage than any construction site bravado. I almost died because I was too proud to listen to a woman half my size," Tank said, shaking his head in amazement. "How's that for irony?" "Size has nothing to do with wisdom," Sarah replied. "Some of the strongest people I've ever known were physically small. And some of the gentlest giants I've met were men like you, tough on the outside, but capable of great kindness when they let their guard down." As the orderlies prepared to wheel Tank toward the operating room, he held on to Sarah's hand for one more moment. "When this is over, when I'm better, I want to do something for you. Help with your licensing process, write letters of recommendation, whatever it takes. You saved my life, and I won't forget that." Sarah smiled, and for the first time all day, it reached her eyes. "Just get better, Mr. Rodriguez. That's all the thanks I need." As they wheeled Tank away, Sarah watched until he disappeared around the corner toward the surgical suite. Dr. Martinez approached her, reviewing the chart one final time. "Excellent work tonight, Chun," he said. "That was a textbook catch on a case that could have easily been missed." Sarah nodded, already thinking about her next patient. "Thank you, Dr. Martinez. It's what we do here." "Indeed it is," he replied with a smile. "Indeed it is." In the distance, Tank's voice echoed down the hallway as the anesthesia began to take effect. "Thank you, Dr. Chun. Thank you for seeing what everyone else missed." Sarah smiled to herself as she picked up her next chart. Sometimes the biggest victories came in the smallest packages.